Module 3.3. As a reminder, it's recommended to print the video script and annotate the script while watching the video for later use. Video scripts are available on Canvas. Module 3.3. How do researchers reduce the likelihood of confounding? If we have a randomized experiment, are we guaranteed there is no confounding? Just because we randomize an experiment does not mean it is without flaw. One of the goals of a randomized experiment is to treat all the subjects the same in every way except for the actual treatments being compared. Let's look at some examples of things that can go wrong in an experiment. Example: a drug company developed a new medication to treat severe ADHD in young children. The firm hired a child psychiatrist to test the effectiveness of the drug. He identified a group of children with severe ADHD and randomly assigned them to a drug group or a sugar pill group. Nurse Brock was instructed to administer the drug, while Nurse Ellis was instructed to administer the sugar pill. The two school nurses checked on the children each day and took notes. At the end of the month, the notes were compared. In general, children in the drug group had better attention and behavior compared to children in the sugar pill group. Do you think it's safe to conclude the drug helps with severe ADHD? Notice that we have a randomized experiment since the children were randomly assigned to drug or placebo group. Even though we have a randomized experiment, there is still an issue with the study. The nurses knew if the children received the drug or the sugar pill. Knowing which drug the children received may influence their perception of the children's behavior, introducing bias into the study. How can we fix the study? In a double-blind study, neither the subjects nor those who interact with them and measure the response variable know which treatment a subject received, which can aid in preventing unintentional bias. Example: researchers conducted a study on the effectiveness of a knee surgery to cure arthritis. Each patient was randomly assigned to have the knee surgically repaired or not. All of the patients who had the knee surgery repaired reported feeling less pain. Is this evidence that the surgery causes a decrease in pain? When determining whether a treatment is effective, it's important to have a comparison group known as a control. In terms of the knee surgery example, it's not enough to know that the surgery group improved. We need to compare them to a control. All randomized experiments need either a control group or two different treatments to compare. In the knee surgery study, those in the control group received a fake knee surgery, known as a sham surgery. The patients were given anesthesia, and the skin around the knee was cut open and stitched back together without doing anything to the knee joint. The patients in the control group had no way of knowing that nothing had been done to the knee to relieve arthritis. Amazingly, all the control patients also reported less pain. In fact, the improvement was indistinguishable between those receiving the real surgery and those receiving the fake surgery. You can read more about this study by following the link in the script. Often people will experience the effect they think they should be experiencing given if they aren't actually receiving the treatment. This is known as the placebo effect. In an experiment, control groups should be given the placebo and inactive treatment as often as possible. Using a placebo is only helpful if participants do not know whether they are getting the placebo or the active treatment. There is a fascinating podcast about the placebo effect. You can listen to it by following the link in the notes. You will also listen to that link for one of the homework assignments. Are there other ways to set up an experiment? There are many other ways to set up an experiment. There are entire courses dedicated to learning about experiments. Watch this video, which is also located in the video script, to learn about some basic designs. Also located in the video script are spaces where you can describe both a randomized block design as well as a matched pair design based on the video that you watch. Previously, we discussed randomly selecting a sample from a population. In this module, we've looked at randomly assigning treatments. How do they relate to one another? There are two types of randomization: randomly selecting the sample and randomly assigning the treatments. First, looking at the picture on the left, the question you ask is the sample randomly selected? If yes, then we can generalize our results to the population. If no, then we should not generalize results to the population. Was the explanatory variable randomly assigned? If yes, we can make conclusions about causation. If no, we cannot make conclusions about causation. Ideally, we would have both a random sample and be able to assign treatments randomly. Unfortunately, it is usually not possible to do both. If the focus of the study is to use a statistic to estimate a parameter, you need a random sample but do not need randomized experiment. For example, estimating the percentage of trees which have a disease. If the focus of the study is to establish causation between two variables, you need a randomized experiment and can settle for a non-random sample. So, for example, testing the effectiveness of a new drug. This concludes the Module 3.3 notes.